This is Scott Becker with the combined episode of the Becker's Healthcare Podcast and the Becker Private Equity and Business Podcast. Thrilled today to be joined by a brilliant leader from Columbia University. We're joined today by Stan Kachnowski, and Stan runs the HITLAB program, the Health IT Lab program, which it does a brilliant take in education around digital health. I've been privileged to participate in it a few times. He's going to talk to us about sort of the evolution of that program, the next upcoming program, why it's been so well received, who are some of the brilliant speakers and leaders that he's had there, and a lot more. Stan, can you take a moment to both introduce yourself and tell us about the Columbia University HITLAB program?
Hi, Scott, and great to be with you today, and appreciate your time and efforts and everything you've done as well to build such a tremendous ecosystem in health IT and digital health and biomedical informatics over the last 30 years. It's been great reading all of your publications and following you as you've done such a tremendous job in building up the ecosystem around not just the US, but around the world. But I've been teaching and research for about the same time. Again, started my career at Quinnipiac University in the early 90s, teaching in the School of Business, Healthcare Technology and Management. And I was recruited to Columbia in 96 with the advent of the World Wide Web and the need for more education and more training in health IT, biomedical informatics, and digital health for public health students. So I went to the School of Public Health at Columbia in 96, and I've been at Columbia ever since, currently running the digital health program at the School of Business, and also visiting professor at the Indian Institute of Technology, as well as a fellow at the Royal Society of Medicine in England. I've done a lot of work with the National Health Service in the UK, and my doctorate is from Oxford, so have a very close connection there. But in general, today we are focused, and the work that I do as chair of HITLAB really focused tightly on the teaching and the research, publications and programs needed to help institutions, whether it's hospitals, or life science companies, or health plans, or large employers, or investors, or CEOs of digital health startups, executive directors of family foundations, directors of World Health Organization and other multilateral organizations, bring their health systems into the 21st century. The digital transformation in healthcare is running behind schedule. It's effectively something that when you walk into a doctor's office and you see paper, you know healthcare has not been digitally transformed yet. When you want to make an appointment to see a doctor and you have to use a phone, you know we're not there yet. Think about when you travel, think about when you use a bank, think about when you order food online, whatever. Everything has been digitized. Most things have been digitized. Your media, your music, healthcare is lagging behind there. And that's what I'm leading in terms of the testing for efficacy of digital health products, and for teaching executives on how to better transform their organizations internally, as well as adapt their organizations externally to better serve their patients around the world.
And take a moment on the HITLAB program, because the digital health programs you put on, there are these great cohorts. I participated a few times and had a chance to visit with just terrific people from industry, from health systems, from graduate programs, from every place. Really bright, really nice people trying to, round out their thoughts and thinking and skills around digital health. Tell us about the HITLAB program, your next program coming up.
No, I appreciate that. And again, you've been so helpful in not only teaching the hundreds of executives that have been in the program over the last several years, but also in promoting the program. So thank you, Scott, for that. And again, another tremendous impact statement in your amazing career. But the program that we've had is really focused on 4 major areas. And we run 4 different certifications each semester in digital health therapeutics, investing, strategy and transformation, and data science and AI. Each one of these programs are aimed at helping leaders, executives, if you will, but it could be physician leaders, it could be executive leaders in hospitals, health plans, employers, life science, startups, it could be investors, trying to understand the world of digital health. It's a very different world. It comes layered with nuance around how to identify digital technologies, how to evaluate them, to ensure that they're ready for prime time, how to contract with them and negotiate licenses and things like that, and then how to implement them, and then how to manage them long term. So these sorts of efforts are wrapped around things like regulatory issues, reimbursement issues, patient centricity and patient user experience issues, and large economic issues, and ultimately clinical endpoint issues. And so as a leader in today's healthcare system, without having a full grasp of all of the terms, with all of the terminologies and technologies, and then ultimately the techniques, minus the understanding of those various layers, you're really walking into a situation where there's just not enough in your baggage, in your toolkit, if you will, to build your house. And so you want to make sure, if you're going into a situation where you're building something as an executive, as a leader in healthcare, life sciences, you want to have a full bag of tools, and that's what we provide you.
The world's changing so quickly. Like, what's the most popular topics today? What are people most interested in right this moment?
And without a doubt, and to answer some of your other questions too about what's coming up, the program we have coming up next, and this is really going to address the biggest issue right now, the elephant in the room, if you will, is artificial intelligence. Everyone's trying to understand artificial intelligence, AI, data science. How is this affecting, or how will it affect their internal operations, whether it's a life science company trying to do better clinical trials more efficiently that will have much better outcomes for patients in the long term, to their external patient populations. How can we use artificial intelligence to help enable our patients to have a much better experience as they're entering their healthcare encounter and as they're exiting long term, whether it's during the healthcare encounter, whether it's in the exam room or in the surgical center, and how can AI better improve their experience there, better improve the actual intervention, and then long-term management, how can AI improve that as well? We're seeing now a revolution in AI we haven't seen before. There was a lot of talk about AI, circa 2010 to 2020. There were a lot of big projects that were launched, not a lot of outcomes. If you look at the peer review publication, if you look at Becker's Healthcare Review, all the publications that Becker's put out, there was a lot of talk and a lot of inspiration. Now what we're seeing is there's now a lot of implementation. People have learned from the decade one, if you will, of AI in healthcare. They've learned what works, what doesn't work. Most of it didn't work. You didn't see a lot of peer review publications talking about how AI had a 100% accuracy rate in diagnosing cancer patients. You didn't see AI, peer review publications about AI having 100% accuracy rate in helping schedule patients to go to see their physician, et cetera. There was no major landmark study talking about how AI did something as good as a physician. What we're seeing today now is that there are two types of processes that are going to come out of the next 5 years. Between now and really 2028, 2030, it's going to be the physician or hospital or the health plan that did not implement AI, and they're now running behind schedule. And then there's going to be the physician, the hospital, the health plan, the life science company that found a way to utilize AI with clean data sets that were well integrated, that were very well targeted, and that enabled and assisted. Again, no one's going to be replaced by AI anytime soon in healthcare. There's too much human contact. But the idea of having AI as an assistant, so we've learned how to harness AI to assist study managers in doing better clinical trials, to assist physicians in being able to identify root causes of disease and be better diagnosticians. We're finding ways where AI can assist a nurse in tracking medication adherence, or help a pharmacist ensure that there's no drug-to-drug interactions for this patient that's in front of them at the counter, et cetera. So there's a number of ways over the next 5 years that we will see healthcare made better by AI. And that's really the hot topic everyone's focused on these days.
Thank you. And take a moment, Stan. AI is right there, 100%. Digital health, AI, and more. how do people learn more about when's the exact dates of the program you have coming up? Tell us about a couple of the speakers, but give us the dates of the program you've got coming up, and where is it at? I know it's at Columbia University, but tell us just a little bit about the upcoming program.
Now, and I think that's the exciting part about this is that the program coming up at Columbia it's really like a digital health week. It really kicks off on Tuesday morning and if you go to hitlab.org and you look at the front page right away, you'll see what's called the Innovators Summit, and it is a 3-day program with world executives from around the world, such as like the United Nations and the Innovation Lab at AARP, the World Bank, and it's an interactive 3 days where people will learn from the folks at the pinnacle of the healthcare system, like Bill Taranto from the Merck Global Fund, one of the largest digital health funds in the world, over $1 billion invested over the last 10 years, by far the most successful. I mean, you talk about returns, 2.1, 2.2 return rate on the fund. As you know, obviously, Scott, with Livongo that came out of Chicago, they funded Livongo and helped get that going and then bring it public. Folks from the American Medical Association, again, Meg Barron, who heads up the digital health strategy efforts at the AMA and again, Chicago. And folks like Amy West from Novo Nordisk, who's been leading digital transformation for Novo Nordisk US for 10 years. I've known Amy. She's just an incredible leader and is doing incredible things there. And then some of the heads of the biggest health data and AI programs and ecosystem stakeholders as well, like Eugenio Zuccarelli from CVS Health, who leads a lot of their data science efforts, Bishan Singh from Microsoft, who leads a lot of their transformation data science and AI stuff at Microsoft. And then, again, going back to Chicago, Jason McLear from Transcarent, who heads up the chief commercial efforts there. He's when you look at Transcarent, what they're doing in digital and in healthcare delivery now, you're seeing AI and digital health transform healthcare delivery. And Transcarent, you saw their $200 million SPAC earlier last year rather. They're growing like gangbusters. They just purchased a $100 million AI company. So Jason's going to be talking about that and talking about how that's improved things. And you'll see Dr. Mohammed Babi from Kenya, who's coming in. He's been doing work for the United Nations in Sudan. He'll be on site and he'll be showing people how telemedicine and digital health has been helping folks, moms and babies stuck in the Sudan who are getting help using very rudimentary sat phones and video screens to do what they have to help patients in need that are stuck behind the lines in the Sudan. So, that's just some of the leaders there. And then you'll see some of the most amazing emerging tech that's coming out of not just the US, but around the world, like TeleVue, which actually comes from Canada, which is an AR, VR goggle that surgeons use while they're doing surgeries in Africa, Asia, Latin America, in underserved populations, even in the US. And surgeons at super specialty centers like Memorial Sloan Kettering in New York City, obviously Columbia Medical Center in New York City, and Rush Memorial and Northwestern Medical Center, surgeons can help by looking at their computer and talking into a headset that the surgeon's wearing. They can help these surgeons do surgeries that are maybe done once every 5 years in their village or in their town or whatever, but they're done 400 times a year in New York or Chicago. That's where you see you're going to see those types of technologies at this summit as well. And again, this is June 27, 28, 29 in New York City. And again, go to hitlab.org to take a look at it. But these are the sorts of leaders that you get to meet. These are the sorts of technologies that you get to see. And it really is, it's just a nice time of year. The summit now is held at Columbia 2 times a year, once at the end of the spring semester, and then once at the end of this fall semester. So the last week of June and the last week of November, right after Thanksgiving, it's always a time where folks can come on campus. They can see what's happening. They can meet a lot of professors. Olivier Tubia from the business school. He's the Globinger professor of business at Columbia Business School. He's going to be talking. number of others as well. But that's the kind of background, that's the kind of interaction you have where you can not only learn a lot, but you can also meet a lot of folks, and then you can also be inspired. We call it education, connection, and inspiration.
Stan, I want to thank you for joining us. We're huge fans of yours and the programs you put together. None do it better. Just a pleasure to visit with you. Stan Kachnowski heads up these digital health programs at Columbia University. Of course, Columbia University, one of the most renowned universities in the world. Fabulous job of bringing together great leaders, great cohorts, great learning. Stan Kachnowski, thank you so much for joining us today on the Becker's Healthcare Podcast, the Becker Private Equity and Business Podcast. Thank you for your time.
Scott, as always, thank you again for the invitation, and thank you for everything you're doing in healthcare, not just around the country, but around the world.
No, thank you so much.